After this webinar is finished, it will be on archive on our website. It's www.hongfook.ca, and it's going to take about a week or so to have it available to us. Secondly, I'd like to remind you, if you during our webinars, if you have any questions, please type in the questions box and send it to all panelists. So that way, everybody will be able to see your questions, and our speaker will be able to try to answer your questions as soon as she can. And if you have experienced technical difficulties, please also type in the question box and send it to the host. That way we can fix your problems as soon as we can so that you can join us. Lastly, as soon as you finish your, we finish our webinars, there will be a survey that pop up on your screen. Please take a few minutes to fill it out. That will help us a lot for our future webinars. As you might know, this is a new technology, so we're trying to improve every session. Without further ado, I'd like to introduce you to our speaker today. Is Dr. Patricia Spindel. She has extensive experience working in human services sector for many, many years. And she is working on, just finished actually, is a book called Working with Family. Please help me welcome Dr. Spindel.
Hey, thank you, everybody. Nice to see the people in this room. I can't see you, but I know you're out there. So hopefully this will be an interesting webinar for you. I want to just begin by saying what we're going to be talking about. It's broken into 4 segments, so you're going to see segment 1 on your screen. The very first, I'm just trying to go back here to the very first slide. It's not going back right now. Can we get it to go back? There we go. Okay. Yes, the webinar is about working with immigrant and refugee women who have particular needs, of course, that men may not have, but they may also share some needs with men. And so we're going to discuss a little bit about what the particular needs are of women who have immigrated to this country or who are refugees. As you can see by the quote, a lot of women who come will come from societies that have a very different culture, very different view of life than we do, and so we have to be very sensitive to that we may be dealing with people who just have a very different worldview than we do, and so we need to just keep that in mind, that they may be primarily centered around their home, around their families, where Canadian women who have been here for, say, 4 generations may have a very different view. So we just have to be careful of that. The first thing that I want to talk about are the statistics. I think a lot of times you haven't gotten statistics. So this is very interesting because it has implications for who is here and how we should be working with them. As you can see by the numbers, many women come as part of the family class, and a smaller number come for economic reasons, but it's still a pretty high number who emigrate for economic reasons. Refugees are practically even, male and female, so you'll see, almost 10% of the population that comes are actually refugees. If we look at the age, this is an interesting statistic. Most women who emigrate at the highest proportion are between 24 and 44. And so we have to keep that in mind when we're considering services, because that's a very high proportion of women who are coming in that particular age range. 45 to 64, you see still 19,000 came last year. 65 plus, that's a lot of older women who are here as well, so they have particular needs. If we look at where people are coming from now, there's the percentages. A much higher percentage, twice as many people coming from Asia and the Pacific as coming from, for example, Africa and the Middle East. And that's a shift in demographics that we've seen the last few years. So a very high proportion of women coming from Asia and the Pacific. If we look at where people are settling, this won't be new to people who work in Toronto. 40% of immigrants come to Ontario, and of those, 31%, over 31%, settle in Toronto. So we have a very high immigrant and refugee population here in Toronto. And of course, that puts considerable strain on services if they're not keeping pace, and it makes it much more difficult to try to refer to services. Because of that, I just want to talk quickly about the other options to services. We don't have to always refer to professional services. Sometimes we can find very valuable resources right in the already settled immigrant communities here. For example, let's say a younger couple has come and the strain of immigration has put a real strain on their marriage. If that happens, it might be helpful for them to be supported by an older couple who have already gone through that process and who can actually help them through that process. They don't necessarily need marital counseling. They may just need to spend some time with an older couple who have already been through this. Okay, let's look at the top languages for a moment. There you have it, Tagalog, 9.6%. English, people who immigrate, still 9.5% speak English. But if you look at the next groups, Chinese, Punjabi, Mandarin, and Arabic, some are down slightly, but some are up quite a bit. So we see Chinese and Punjabi speaking people. That number is up from 2010. What that means is it has some implications for interpreter services. What we should be doing, perhaps, is making sure that we're recruiting more interpreters from the Chinese and Punjabi communities. Okay, let's look at employment just for a moment here. If we take a look, this is an interesting statistic. For men, 17.5% of immigrants are in the managerial class. Only 8.6% of women are actually in the managerial class. But if you look at the professional category, and we're now talking about nurses, teachers, maybe psychotherapists, people who would fit into the professional system, there are many more women in that system than there are men. So the figures are, again, reversed a little bit. In skilled technology, again, fewer women in the skilled sector, the technological sector, and a slightly higher number in the clerical sector. Now, those numbers are a little surprising. What that means is that the people who are immigrating, the women who are immigrating to Canada, are primarily in a professional class. Okay, so they're bringing certain professional skills to this country. Okay, so let's take a look at what do all these statistics actually mean. What they mean is that right now in Canada, 1 in 5 women are born outside of the country, which is a fairly high percentage. Almost half of Toronto's female population are immigrants now, and that is a very big change from, say, 10 or 15 years ago. The majority come under the family or the economic categories, and that has particular implications for what kind of support and services that they actually need. Many recent immigrant women are visible minorities. Again, that has implications for how they're treated as they're integrated into the country, for how they're treated when it comes to employment, when it comes to housing, you know, whether or not there's discrimination. They may face greater levels of discrimination. Most are wage earners, and they have a higher number of women who are wage earners are working part-time. So that has implications for their poverty levels. If they're only working part-time, they don't have the same kind of health benefits or other kinds of things. They don't have employment benefits particularly. They're certainly not making as much money necessarily unless they've cobbled together 2 or 3 part-time jobs to try to put together a full-time salary. If that's the case, then we're looking at some real issues potentially around childcare. If a woman has to work, at 2 or 3 different jobs, then the childcare situation she's in becomes critical. Are her children being left alone for periods of time, or is she able to access reasonable childcare becomes a question. And it's a question worth asking, especially if women are working 2 or 3 part-time jobs. So, given that so many are working part-time, it's not surprising to see that 23% live in low-income situations. Okay, and that's compared to only 16% of Canadian women. Obviously, we'd like to see that percentage be 0 for both Canadian women and immigrant or newly settled women, but 23% is quite high. Okay, so we also know more women are immigrating than men. So what does that mean? Does it mean that men are already here and that they're sponsoring their wives or significant women in their lives? Or does it mean that women are emigrating on their own? Both are probably likely. Probably some women are emigrating on their own, but some are being sponsored by men. And that has particular implications as well, especially around whether or not they have permanent status. Because if they don't have permanent status, being sponsored by someone else may put some women in jeopardy depending on what the nature of the relationship is. More women than men are in the family class, so that would seem to indicate that they may be being sponsored by men. Fewer women, but still a very high number, come for economic reasons, so they have particular needs that women who maybe are stay-at-home homemakers are not going to have. And stay-at-home homemakers are going to have needs that women who are have full-time employment don't have. Slightly lower percentage of women than men are refugees, but that's still significant, especially when you consider that women are often very badly hurt during times of war. And of course we have a lot of wars raging across the world right now, where women are being horribly abused. And so many of the refugee women who come may have had to deal with extreme adversity, and their children may have had to deal with extreme adversity as well. So we have to be sensitive to that, and we do not currently have enough resources in Canada to adequately help women who are coming with complex PTSD as a result of having been horribly brutalized in a war zone or a war situation. We saw that female immigration is higher in all age ranges, and so we have a greater number of women than men coming, and we have to begin to really consider how their needs may differ from men's needs. More women than men are emigrating from the Asia-Pacific region. So that, again, has certain implications. First of all, we'll need to know, do the women who are emigrating, do they speak English? Do they have needs around learning English, around learning literacy skills so that they can get good jobs? Because we have so many women coming who have professional backgrounds or credentials, it would seem that those women probably already do speak English, but there may be a number who don't. The women who already speak English will be looking for jobs in professional categories, but this is where they may run into some problems because their credentials, which were received in other countries of origin, may not be recognized in Canada, and I'm going to talk a little bit more about that a bit later. My own background is in post-secondary education. I just want to say something quickly about that because credential recognition is critical for a lot of people who come from other countries who want to obtain professional positions or managerial positions. And it's an ongoing problem. It's been a particular problem. I know some of the colleges, the professional colleges, are certainly looking at this. When I was on the Council of the College of Social Workers, for example, they were making a real effort to see what could be done about credentialing, about having people with credentials from other countries actually become members of a professional college, because that's vital to being able to get a job in a professional capacity. So let's say you're a social worker and maybe you're coming from Hong Kong. If you want to obtain a job as a social worker, an equivalent job in Canada, it's very likely that your employer is going to ask that you be registered with the Ontario College of Social Workers and Social Service Workers. If that happens, then your credentials will come into play. To be registered, your credential has to be recognized. So that's why it's so important that colleges like that college are actually taking a look at credentials and trying to make it easier for people to be able to register with their college. The other thing that I just want to mention quickly about that, about professionals coming to Canada and getting their credentials recognized, some colleges are further ahead than other colleges, community colleges I'm now talking about. They're further ahead than other colleges in doing something called prior learning assessment. Prior learning assessment is a little bit different from just straight credential recognition. Prior learning assessment actually helps people by assessing what they know as opposed to what credential they have. And so, for example, somebody may have been doing family counseling in India. If they were doing family counseling in, say, India, they have a certain credential from India. Their credential may or may not be recognized, but if they're adept at family counseling, they may be able to do something called challenge exams, for example, as part of a prior learning assessment process. And so they may be able to get course credits in Canada based on the knowledge that they already have. So it's worth actually talking with community colleges and asking them what their prior learning assessment processes are, because that can be very helpful for new immigrants or newcomers to Canada to have their knowledge assessed as well as just their credentials from colleges or universities. What we saw in the numbers as well is that higher numbers of people speak Chinese, Punjabi, Urdu, Farsi, and Somali. And so we really need to look at trying to make sure that we have interpreters who can assist people, and also that if there is a language difficulty, that people are able to be referred or assisted to really get a good command of the English language, because it'll prevent them from getting jobs, as you know, if they don't have that. Women are less likely to be managers, as I mentioned, but they're more likely to be professionals. And so women in the professional class, that's the largest class. So they have particular needs, and credential recognition will be one of those needs for sure, which is why I just spent some time talking about prior learning assessment, talking about credential recognition. Far fewer women in the skilled and technical areas. Now, those are areas where they're quite in demand. For example, refrigeration technology is in very high demand. That kind of technology, very high demand. It's a good idea if women are considering post-secondary education to try to channel them into those areas. If they have any interest in those areas at all, that may be a very good field for a lot of women, because they'll make a very good living there. And it may be something that they hadn't considered, but they may have good technical skills. And so it's a good idea to try to channel women, if possible, into the skilled or technical trades. More women are clerical, but not a great many more. And clerical jobs these days require quite a bit of skill, computer skills. So women learning computer skills is a very good idea. And I know Micro Skills in Rexdale does a very good job of that, and that's a good place to refer if women are looking for gaining computer skills. Many women may not be working, they could be homemakers. If that's the case, they're going to have particular needs that I'll talk about in just a moment. So that's the end of segment 1. I just want to ask right now, if people have questions about that, if you would just type your questions in the question box. I'm going to make an effort to answer those before I move on to segment 2. So if there are questions, please feel free to go ahead and type those in now, and I'll do my best to answer them. That's also how I know you're there, so type a question, just let me know you're there. So I'll just give you a moment to do that, and then we'll move on to segment 2. I'm checking my time to make sure I'm on time here. Okay, is everyone satisfied? Are we all right as far as questions go? Because if we are, then I'll go ahead and push on. I see people are able to hear now, which is great. All right, so in segment 2, we're going to look at what the challenges are for immigrant women, and what do the statistics actually mean? Right off the top, one of the things that the statistics mean is that a large proportion of women who immigrate to this country may be economically dependent on men for a variety of reasons, as I've mentioned before. And that has certain implications as far as trying to assist women in that situation. That can be fine, and that can work fine, but it may also be a problem in the sense that if the relationship is not stable or the relationship is in trouble, sponsored women may also be in trouble at that point economically. And a lot of times, somebody just wrote that they can't hear anything. Do you know which questions do the prior learning assessments ask? Okay, that's actually, I'm just going to go back for a moment. Which questions do prior learning assessments ask? It would depend on the field that the person is in. So for example, in social work, let's say they want to get a prior learning assessment that gives them a credit for the family dynamics course. In that course, they would be asked specific questions based on whatever textbook is being used in that class. Oh, are we on? Are we here? Yes? Okay. So the questions for family dynamics, the way it works would be this. Let's say I'm coming from India, and I've been doing family counseling for a very long time, and so I have very good skills in that area. I have a degree from a particular university, but for whatever reason, my credentials are not being recognized here, not in colleges, not in universities. What I could consider doing is I could consider going to a college, asking what their prior learning assessment process is in their social service work program, for example, and I could then say, I would like to challenge the family dynamics course. I believe I have the knowledge for that course already. I don't want to have to take it. I also want to challenge 2 or 3 other courses. Very likely people would be asked to do a challenge exam. And so the challenge exam would actually have questions from very likely what's being taught in that course. So if the person knows the answers to those questions or seems to have a pretty good broad knowledge of family dynamics, based on the challenge exams and then passing it, they could very well get credit for that course. There's a variety of other things they can do too. They may be asked to write an essay about some aspect of the family dynamics course. And so a professor will mark that essay, and if they seem to have a very good knowledge and background, they could get credit for that course. So that's the way it works. It depends on what the prior learning assessment process is for whichever course the person wants to challenge, and then it'll be based on what's taught in that course, so the person would have a chance to look at what's taught in the course and prepare and maybe write a challenge exam or an essay, or maybe even have an interview with someone who will assess their knowledge. So that's the way it would work. Do I have statistics that show that women will be hired when they get those technical skills, as I mentioned? If you look at the Government of Canada puts out statistics on which areas are in demand in Canada. So you want to put in employment statistics. You want to Google employment statistics. And I think what you'll see is that there are particular areas, especially in the technical trades areas, where we actually have shortages of people. There aren't enough people who can come and fix your refrigerator. There aren't enough general contractors. Any of you who've ever tried to do renovations will know right away that trying to get a general contractor to come in and do a renovation on your house can take months. So if women learn carpentry and renovation skills, and they can become accredited with those kinds of skills, they can literally set up their own business as renovators, and they could probably make a fair bit of money. So yes, I mean, I think if women got those kinds of skills, drywalling skills, carpentry skills, being able to do tiled floors, those kinds of things, I think that they would be scooped up right away, because you literally can't get people who are general contractors who can come in and renovate your house. And, you know, you can just, when you try to make a call, you'll see right away they'll say, well, I can come out in a month or 2 months, because they're in so much demand. There just aren't enough of them. So that's what I meant by having good technical skills. That's based on English ability. What supports are available for professionals with limited English? Okay, I think then we're looking at trying to increase people's English language skills. And I know that there are quite a number of agencies that do provide literacy training for newcomers. Essentially, it depends on what professional skill area people are wanting to go into. In social work, for example, if you're going to be a social worker for a particular immigrant community, then the language skills may not be as critical, because you'll be speaking to people in their own language. In other areas, like let's say healthcare, where you have to be able to read prescriptions, or you have to be able to give medication, then your English skills would have to be a lot better. So it really depends on which professional area people are interested in going into. People with limited language skills, depending on what professional area they want to practice in, may want to ensure that they're serving the community whose language they actually speak, and they may actually be hired based on that basis. It may be seen as a strength. But some English will be necessary for sure, and so becoming more literate in English is never a bad idea. For one thing, it gives people more opportunity to move to different jobs than they would normally have if they were just working, for example, an agency that serves immigrants who speak their language. If they want to move into other agencies that serve other communities as well, they would have to still improve their English skills. And they can do that by joining various literacy programs that a lot of agencies operate right across the whole system. I'll actually talk a little bit more about that later. So, okay, I'm going to try and move the slide here, but I don't know if I can. No, I can't move the slide on my screen at this point. So just one moment, we'll get that happening. There we go. Okay, let's make sure I've covered all of that. Okay. Yes, one of the things I did want to mention is that some of the women who are working even in a professional capacity, if they're in female-dominated jobs, they're probably still earning less than men. And so women will be trying to look at how they can increase their skill levels or broaden their skill levels so that they can begin to earn more. And that's where they should really consider looking at certificate programs that are available in both universities and colleges. Certificate programs sometimes are considered to be just as valuable as a diploma program if they're very specialized. So for example, again, if I use social work as an example, let's say I'm an immigrant woman and I'm right now working for an agency serving a particular immigrant group. I want to get a job in case management in a mental health agency. I've heard they pay more, so I would like to move into that. An example might be that they could take a certificate in case management, which is maybe 6 courses, and at the end they're certified as case managers. And by certified I mean the college issues a specific certificate that shows that they've been specialized in that area. That would be very valuable to them if they want to move into, say, case management. Let's say they want to do crisis intervention work, that kind of work in a hospital. Or if they already have, say, a BSW recognized and they want to go into crisis intervention, then they can take a 6-course certificate in crisis intervention. The colleges offer those courses. So they can look up areas of specialty and they can take 4 to 6 courses and gain that area of specialty. There are also online courses available that people can do. That looks very good on a resume, so it makes people more marketable when they're going out to try to get those kinds of positions if they have specialization in that area. Okay, so moving to the next. Women are settling in highly populated areas, and especially Toronto and Montreal. So if we look at this situation, we've got 10% of women who may be refugee women who are suffering potentially complex post-traumatic stress disorder. They're plunked right into the middle of a high population area where they're going to be suffering culture shock. Very likely they're going to be disoriented in addition to having these PTSD symptoms. So the fact is that we need to be able to really assist women in that situation. They're going to have extremely high needs. I'm just going to go back to that slide. It's not on my screen at the moment, so let me go back to that slide. Got it, there we go. Okay, so now women from the Asia-Pacific region may not be in this situation as much as women from other areas, especially the Middle Eastern regions, where, as we know, there are ongoing wars at the moment. So they may or may not be able to speak English. They may or may not have complex post-traumatic stress disorder. They may or may not be suffering culture shock, but if they are suffering all of those things, and they have English language challenges as well, those are going to be the highest risk groups of women that we're dealing with. And so the majority, the bulk of resources should be going to assist them because they are going to be at the greatest needs. So if you have people on your caseload who've come from war-torn areas, it really pays to ask them the question, whether they are sleeping all right, whether they have flashbacks, whether they feel disoriented. You know, you want to begin to check that out. I'm going to talk a little bit more about that later. Again, we mentioned child care and the critical need for child care, and we'll talk in a moment about how that can happen. Okay, those who aren't working and sponsored, as we mentioned, may be isolated. They may also be dealing with domestic violence, and so it's critical that we inquire about that, especially if we have any particular reason to inquire. If we notice that a woman has bruises, for example, you want to be able to ask, are you all right? Are things okay? Because if they're not, this woman may need some help. She may even need medical assistance. Okay, one of the things that immigrant women face is discrimination, prejudice and discrimination. And that's not arguable at all. The question is, why do they face discrimination and prejudice? And it seems to me, having observed this for a long time now, that the general population is very likely ignorant of what their stories are. They're very likely ignorant of what immigrant and refugee women have actually gone through. And because they're ignorant of that, they can often be prejudiced and discriminatory towards them. So wherever possible, what we need to do is some public education. We need to start telling the stories of immigrant women so that the public starts to get a sense of what these women may be struggling with, so that when they see somebody in the grocery store who's struggling, who seems not to know what they should buy, or they don't understand the pricing or the money, or they seem distressed, you know, hopefully what we can do in educating the public is to make the public more helpful for people who have recently come here. I had a similar experience myself in the grocery store where I saw a young Asian woman who was struggling with money. She didn't know how to pay for her groceries. And so I just stepped up and I helped her pay for her groceries because she didn't know how. Those are the kinds of things we need to teach the public, that they can be helpful that way. And far from standing in the lineup and being annoyed because somebody is taking longer to pay, maybe being sensitive to she doesn't know how to pay, you know, you can be helpful instead of frustrated in a situation like that. Okay, skills and academic achievement we've already talked about. Language barriers, same thing, we've talked about that, and that there is language training available across the city, and so trying to set that up. That's another area where a buddy system can be helpful, where there may be somebody who's been settled here for quite some time who's willing to mentor someone and teach them the language, and that's often less stressful and less intimidating for somebody who's trying to learn English. Okay, I want to talk quickly about domestic violence. Every 6 days, a Canadian woman is killed by her intimate partner. If a sponsored woman has a 2-year waiting period before she can actually, end the risk of being deported, or have her sponsor cancel her sponsorship. A 2-year waiting period can be a long time, especially if you're in a situation where someone is extremely abusive. In that 2-year period, a woman can be injured. She can completely lose her self-confidence and making her almost unemployable. So it's very important that if we see or we get a sense that somebody may be in a domestic violence situation, that we intervene and that we say to the person that it's all right to talk to us about these things, that it's all right to make a plan, that somebody can make an independent application, independent of the person who's sponsoring them, and maybe hook them up with legal resources. That's extremely important to do. Women can appeal on humanitarian grounds. Unfortunately, they don't have automatic protection to be able to stay in this country while they're doing that. But they may have a very strong case, and so by appealing on humanitarian grounds to stay in the country, they may actually succeed, and then they won't have the specter of sponsorship hanging over them. Okay, language testing and the increased language testing that's happening may deny some women citizenship. So language skills become critical, which is why that may be one of the areas that we want to focus on, to make sure that there are maybe people we can recruit in existing immigrant communities who are prepared to help people learn language skills. If there isn't enough access to language skills out there, then maybe what we need to do is we need to talk to people who have good language skills and can also speak some of the other languages that people are coming here with now based on our statistics, and actually assist them one-to-one, or maybe mentor 2 or 3 people by sitting down with people 2 or 3 times a week for maybe an hour or so. People can gain language skills that way, and so there may be people who are willing to volunteer. Cultural issues we know can cause oppression. When I was teaching at the University of Guelph Humber and at Humber College, I had young women in my classes who had had to endure genital mutilation. And this is a perfect example of where someone may not understand what the special challenges of people are who come to this country. Because women had endured that, and it had left them disfigured, some women had to take longer to go to the washroom. And so the 15-minute breaks that we were given, they were given in class, weren't enough. And it's very difficult to go up, especially and talk to a male faculty member and say, look, I have this problem because of what happened to me. So oftentimes they won't talk. Then they're seen as always being chronically late coming back from their breaks, and they're viewed negatively, or they can be viewed negatively. I always inquired, especially if it was a newcomer woman or a newcomer man, what the issue might be. But not everybody does. And so again, these kinds of things need to be more broadly understood by the general population, that there are people who have these conditions based on what's happened to them. There are people who are here in forced marriages and are suffering domestic violence as a result. There may be polygamy happening, and so some of these women may be grossly oppressed in their living situations, and the general population doesn't know that this is what's going on. So we need to do a better job of letting the general population know what kinds of challenges people are facing. there is a lack of access to culturally and linguistically tailored legal resources, and that's something that we need to start to talk to legal clinics about. Legal clinics often hire community legal workers. There's no reason on earth why legal clinics should not be hiring community legal workers from different ethnic communities and cultural communities who can speak more than one language. Because if that's not happening, we should be encouraging legal clinics to do that, because that can be enormously helpful, especially to women who are in domestic violence situations, to be able to speak to someone in their own language and have them understand their culture and be able to hook them up with appropriate legal resources should they need them. So that's an area that we should be talking more with legal clinics about. Many women don't know that they can separate their refugee claims from their partner's refugee claims. That's a legal issue that many women just don't know anything about that. We should be doing more public legal education about that, informing women of that, and informing them about where they can get more information about that. Legal resources like CLEO, for example, Community Legal Education Ontario, can put out pamphlets and documents on these kinds of things, and they could actually put them out in many different languages. So approaching CLEO and asking them if they can set out women's legal rights in a variety of different languages would be very helpful. And that would be helpful to settlement workers and others who are working with immigrant women as well, because then they can give them legal resources in their own language. Non-status women, as we know, are afraid to use services or call the police. They're terribly afraid that they're going to be sent back. They're going to be deported. Especially if they've been living under extremely repressive regimes, they're going to have a great distrust of the government. And so it will take longer to gain the trust of people and to help them realize and understand that things are, in fact, different here. The government will not target you if you use services or resources or go to the police. Partners can prohibit people from learning English as well and also keep women isolated. That happens with any woman in a domestic violence situation, but the prohibiting of learning English is especially critical for a lot of women who are here. And if they are in a domestic or abusive situation, that can be a real problem for them. So it pays to inquire about that. Women can be threatened that they'll lose their children, and if they don't know their legal rights, they may believe that, and so they'll stay in an abusive situation. The person may be alienated from their cultural community because perhaps someone is spreading rumors about someone being a bad mother or a bad wife, and that will further isolate the person. So it's worth inquiring about things like that, because all of them place people at a lot more risk. Okay, let's look at the employment and education-related challenges just for a moment. Preparation to succeed in a college or university setting is critical. It's very important for women to talk to student services before they even go into a program, to prepare. Be sure that they know what's expected of them when they're writing essays. For example, I'll use an example of people who come from collectivist cultures think it's okay to work together on an essay and submit the essay. That's what they would have been doing in their own culture. Here in Canada, that would be considered plagiarism, and they would automatically get a 0. So we want to make sure that people know that, no, you can't do that here. You have to actually do your own work and not submit a paper that was written by 5 different people. You literally have to do your own work and submit your own paper, otherwise it won't be recognized. So that's an example of what I'm talking about helping people to prepare for the educational system here. And again, understanding cultural norms in Canada is important. Again, if you come from a collectivist culture and here you are moving into an individualistic culture, space may become an issue. Maybe you're used to living and working in close quarters and you don't see anything wrong with that, and all of a sudden everybody at work is angry with you. Reason being that you're taking up too much space in their view. So those are the kinds of things that people need to know about when they're going into employment. They need to know, look, this is an individualistic culture, so people want space. This is the way we do things here. And there's nothing wrong with the way somebody has been doing things based on their culture. It's just it's a different culture, and it will be viewed differently, so people need to know that. We've talked about language. We've talked about discrimination and prejudice. Affordable daycare, that's another issue that many women are going to be going through, and we'll talk a bit more about that in a moment. What happens is that all of those things can keep people in a holding pattern, which is why it's so important to address them. Let's look quickly at the physical and mental health challenges. Women might find it difficult to get maternity care if they don't have health benefits, especially. Poverty can put their physical health at risk as well as their mental health at risk. It's very important to check for depression. And there are at least two different kinds of depression, but the two most common ones is if someone's very irritable and negative, they may be depressed. Not everybody who's depressed just stays in bed and, sort of looks down. Some people may be very irritable as well. And so it's important, if you're dealing with people who are very irritable, to just check for depression, because that may be one of the things that's going on. So you want to go down the depression checklist a little bit and ask them, how are they sleeping? Are they gaining weight or losing weight? Are they eating enough? Different questions related to depression just to see, because they may need some help. Obviously, loneliness is a major issue because they're away from their family and friends. They've left a lot of people behind who they may or may not still be able to communicate with. So it's worth asking about that and helping them to build families of choice here in Canada, where they can learn, meet new people, and actually have a different social circle. A lot of people won't have access to medical care, or they won't have access to a lot of other resources, and that's where settlement workers can be extremely helpful, because they can hook them up with those resources. But so can mentors in their community who've already been through the situations that they've been in. This is an interesting quote. It's taken from a book called Broken Spirits, and I'd really encourage people to have a look at that book. It may be in the library right now, and have a look at that book. It's a very, very good book on helping people who are refugees, especially those who are suffering from complex PTSD. It's written by John Wilson and Boris Drozdek, and both of these people have a very sensitive understanding of what refugees actually go through. And that's why I basically use the quote from the book. It shows you that they do understand what refugees are going through. What's interesting about authors like this, and I just want to mention this, is that if you're working with refugees, John Wilson and Boris Drozdek are both on the internet. You can actually contact them and pose questions to them directly, and I think you would find that they'd be very helpful. Not just them, other authors. If you're reading good books that are really helpful to you, you can sometimes look up the authors and actually ask them questions, and many will be very helpful. They'll be very willing to answer your questions and provide you some support. Okay, we've talked about the horrible trauma some people have suffered and that they may have complex PTSD. You want to check for things like flashbacks, abreaction it's called, where somebody may suddenly re-experience trauma as if it's happening in the present, when in fact it happened in the past. So you want to ask about that. A lot of people mask their anxiety, and sometimes it's masked in obsessive-compulsive symptoms, and I will talk a little more about that later. But you may find that they're in avoidance mode. If people are avoiding a lot of things, or some workers may feel frustrated because people aren't keeping their appointments, or they're not following through on things, check for anxiety, because that may be the issue. A person may just feel too anxious to be able to do that. It may not be that they want to do it, but they're too anxious to be able to. If that's the case, they may need some medical care, so that's and counseling assistance, so that's worth checking. Okay, I want to now go through what special immigrant groups sometimes go through, especially those who've been traumatized. But I want to just stop for a moment just before I do that and ask people whether they have any other questions before I go forward with this. Let me just, questions on the last bit that we talked about. I will be talking a little bit more later about how we can tailor our services and our supports to be able to help people in the situations I've described. So I will deal with that later. Okay, I'm not seeing any questions, so I'm just going to start to go through these slides now. And there are a number of them. Many of you will be working with people who are extremely challenging. Sometimes it's useful to know why they're extremely challenging. I mean, you may find that this is not just somebody who has a bad personality. This is somebody who may be suffering trauma and trauma-related symptoms. So this is why I now want to just go through this part. Okay, the most severely damaged person that you will encounter will be somebody whose spirit is actually broken. There are people who may be suicidal. They don't even want to survive anymore. They seem not to be able to do anything on their own behalf. You'll experience this person as lifeless and is almost numbed. This is a person who needs medical assistance, and this is a person who probably should be referred to the trauma services at Women's College Hospital, which I'll talk a little bit more about later, because this is a person who literally cannot act on their own behalf. They're frozen because of the trauma that they have had to deal with, and they may be regressed to a much earlier stage of development. So make sure that you refer somebody who's in that situation to a trauma practitioner who can actually assist them. Okay, just can't move it forward. I'm just trying to move the slide here. No, won't move. Okay, that's great, thank you. Okay, so the second most damaged person that you're going to encounter is a person who seems passive and very depressed. They may be withdrawn, socially isolated. This is a person who will seem very needy. They'll call you repeatedly. They'll want you to do things for them. It'll be very frustrating for you because you're going to want them to do things for themselves, but they may not feel that they can. So basically, let me just put this ahead. So basically, this person, you'll need to inquire, do they feel like hurting themselves? You know, talk to them about their withdrawal. Try to see whether there's some room for them to be able to start to regain some control over their lives. If you're finding after having tried that, that this person continues to be extremely needy and dependent, then this person probably will also need professional help. They may need help from a physician plus counseling assistance, because this person may also have PTSD symptoms that they haven't told you about. Okay, so it's very important that they get mental health counseling as well. This is a person who feels like they're falling apart, and you'll notice when you're working with a person who has what we call a fragmented self. In other words, their ego is not strong enough to allow them to present themselves as a self-confident person. You'll see this person doesn't take very good care of themselves. Their hair may be dirty, their clothing may be dirty, they may look a little bit ragged. They're going to have trouble functioning just in general, both in their interpersonal relationships, and they're also going to have trouble being able to work independently at all. So they may be very paranoid and mistrustful of people, and they may just sort of appear to space out sometimes. This is also a person who likely will need some trauma support and some counseling. And they may also need medication assistance, okay, to pull them out of their fragile state. And the counseling will be directed towards trying to strengthen and shore up their self-confidence and their ego. Okay, this is a person, who we say has an imbalanced self. What that means is that they have extreme difficulty controlling their emotions. They have major challenges around feeling rejected and abandoned. And if they do feel rejected and abandoned, they will react very strongly emotionally to that. This is sort of the same kind of diagnosis as you'll see in mental health, where somebody's diagnosed, say, with a borderline personality disorder. What that just means is that their emotions are extremely volatile, and they have real trouble regulating their emotions and their feelings, and they will respond very strongly if they sense that they're being rejected or abandoned. So you have to be very careful when you're working with a person in this situation to be supportive, to let them know that you're on their side, and to be very careful that you're not presenting as rejecting them in any way or abandoning them in any way, because they will react strongly to that. This person, by the way, will come across as extremely manipulative. They're not. That's their coping strategy. They feel desperate internally, and so they're going to come across as somebody who's manipulative because they are dependent on other people and they are afraid. And so they'll try and keep people close to them any way they can, and if they need to do that through manipulation, that's what they'll do. Okay, the overburdened self. This is somebody who likely will look like they have obsessive-compulsive disorder. Somebody who has to go through rituals on a regular basis, somebody who it takes them a while to get anywhere because they have to do particular rituals to be able to get somewhere safely. Again, this is a result of trauma quite often. These are people who may have lost a great deal in their lives, and so they go through these rituals in order to make sure that they're in control of their lives and that they're not going to lose anything else. People in this situation may also hoard. So you may be going into their home and seeing that they've kept everything, including candy wrappers, newspapers, everything. That's because they have a particular type of obsessive-compulsive disorder where they can't stand to give anything away because they've already lost so much. So that's something that you want to be aware of. Again, counseling and medication can certainly help in a situation like this. They won't necessarily see themselves as being in trouble. In fact, these people may be workaholics, but they'll be workaholics in a ritualistic way. They'll be very disciplined. They may have some very rigid thinking processes. These are all attempts to keep themselves together and to keep themselves whole. And again, they're struggling against internal trauma and having been deeply hurt. This group of people will come across as extremely critical, scornful. They'll be suspicious of anyone that they deal with. They will not have a belief system that's coherent. So in other words, they may say things one day and they'll say something else the next day. They'll try to stay away from people for the most part because they feel alienated from people. They don't trust other people because of what's happened to them. In other words, if ever since they've been children, they've been badly mistreated, they have learned that the world is a bad and a dangerous place, and they will not want to trust too many people. In fact, they may not be able to trust anyone. So trying to establish a relationship with a person in this situation will involve having to give them enough space and telling them that it's all right to say if they need some space or some room to process things, but being available for them and saying, you can call me, you can let me know, and if it's okay with you, I'd like to touch base with you to make sure, see how you're doing. And if you want to talk, you can, and if you don't, just tell me you don't want to. So in other words, you want to help people in this situation to actually learn how to establish boundaries with other people where they can say, no, I don't want to do that, without having to completely withdraw or be isolated. So they can still take part, but there's certain things that they just don't want to do or won't talk about. And if you can sort of hang in with that, what you'll find is over time, the person may come to trust you more. Okay, a more normative way of approaching trauma is somebody who wants to be with other people a lot, but they may be overly conformist to try to be. So in other words, these are folks who you will wonder what their real personality is because they're trying so hard to please you and be part of the group or be your friend. So what they'll be doing is they'll come across as very approval seeking. You know, like, was that all right? Did I do that all right? You know, was that okay? They'll say those kinds of things repeatedly. That may get on your nerves, but it's important to understand that this is a person, again, who's been deeply hurt, who wants relationships with other people, so that's a good thing. But they maybe don't know how to establish those relationships with other people. So, you know, talking with them in a very supportive way and saying, you know, it would be helpful if you do these things. In other words, using their need for approval to help them understand ways that they can actually gain approval in the society and ways that they can gain approval from other people. That can be very helpful. So you want to say it in a supportive way and show them how they can gain approval, because they may right now be trying to gain approval in ways that they're not going to gain approval. Okay, this grandiose self is basically something that lines up with what we call narcissistic personality disorder in the mental health system. Again, it's an attempt to adapt. All of these, by the way, are ways to adapt. They're all coping strategies, and some of them don't work very well, but these are all ways that people are trying to cope with what's happened to them. This is a person who seems to always want to be important. They want to be the center of attention. They want to control the conversation. So you'll start a conversation with this person, and like seconds later, they will shift the conversation to themselves. And so it'll be very frustrating to try to converse with this person, because they'll say, let's say you say to them, you know, I'm feeling this way. Their response is likely to be, oh, I know just how you feel. I feel that way too, and they'll go right into that. This is, again, a person who's compensating for something traumatic that's happened to them. They're going to want to be affiliated and close to people who they perceive as having power so that they can feel important. Basically, this is a person who feels inadequate inside because of things that have happened to them, and they try to overcompensate for those feelings of inadequacy. So they will come across with what looks like a high sense of entitlement, and they'll be angry when they're not recognized. It's a simple thing to recognize them, to recognize what their strengths are, to recognize the things that they can use that are good qualities that they can use to advance in their careers. So there's no problem with recognizing people if they want recognition. And the sense of entitlement is often the result of being disillusioned. They may feel frustrated because perhaps they were a doctor or a lawyer or another profession in their country of origin, and now they're driving a taxi, or they're greatly underemployed. So they may seem to have a high sense of entitlement where they'll be very demanding, but that high sense of entitlement actually stems from feeling disillusioned because perhaps their new country doesn't meet their expectations. It's quite okay to sympathize with people in that situation. It is frustrating, but it's also important to help them move ahead in their goals. And so recognizing what their strengths are and helping them to move forward based on their strengths is a good approach. Okay, one of the ideal adaptations for immigrants and refugees who have been traumatized is if they've managed to bounce back from the extreme trauma that they've gone through. That's a picture of Malala, who we all know has really promoted education for women. She was shot by the Taliban. She bounced back from that, and she has since become a worldwide advocate for education for women, and continues to be a target for people who don't want to see that. So she's an example of somebody who has bounced back from extreme trauma. Instead of being afraid, She's out there, she's vital, she's secure, she knows who she is, and she's standing up for other young women as well. So she's extremely pro-social. This is a young girl who is extremely adaptable and who has actually adapted very, very well, considering the trauma that she's been through. So this is considered to be a reasonable adaptation. Okay, this is also not an unreasonable adaptation, but people in this situation tend to still be outsiders. They're extremely individualized and they're very resilient. So they will go after what they want to go after. They'll be very goal-oriented. They'll be altruistic. Very likely they will want to see other people succeed as well. But they won't want to talk about their past. They'll be dissociated from their past. So even though their past may have caused them enormous pain, and pain that they need to resolve, they won't want to discuss it. And you see this quite often with Holocaust survivors. You know, people who went through the Holocaust don't want to talk about it a lot of times, and that does continue to cause them challenges in their lives. So on the one hand, it's good that they're moving ahead, that they're very goal-directed, but on the other hand, they may come across as driven, and being driven is not a good thing necessarily. So even though they'll have creative ways of coping with their lives, and they may engage in humanitarian pursuits, which is a good thing, they may also seem driven in that, and that's not a good thing because that can take a toll on them. So while this is a good adaptive style, it's not the ideal adaptive style. This, again, is a desirable way to adapt, where someone has an integrated transcendent self. And the whole idea of a transcendent self begins to look at some kind of a spiritual manifestation, that where a person has overcome extreme adversity quite often, through spiritual transcendence. In other words, they've developed a spiritual perspective that has helped them see the world in a certain way, that's allowed them to move forward and not only transform their own lives, but very likely also be an inspiration to many other people. And so, you know, people like, for example, Martin Luther King Jr., who was extremely inspirational to very many people, but who had a very difficult time having grown up in the segregated South, where he was repeatedly oppressed. But nevertheless, he grew up and he was able to transform this oppression into self-growth, so that he became sort of an old soul. Nelson Mandela, the same thing. Gandhi, the same thing. So their spiritual values guided them, and they were able to move forward and inspire others as well. Okay, are there questions so far? I'm going to stop again just for a moment. We've got about 40 minutes to go, I think. Am I right? So let's just stop if there are questions so far on any of that. Just want to see where we're at here. Okay, questions? No, not yet. Okay, if there aren't any questions, I'm going to just move forward here. Okay. I'm just trying to put the slide back. Okay. Okay, that was the last slide? All right. Nope. Okay, there it is. I think we're good here. Just double check. Okay. All right, so just to reiterate what the challenges have been for refugee women especially, because they've suffered trauma, they're going to need mental health care. You know, as I've mentioned, I've been talking about these different kinds of manifestations that you see as a result of trauma. Depending on the severity, they may need mental health care, and they will likely need trauma specialists if they're in the more severe groupings that I've been talking about. They may need individual counseling, or they may be, if they come from a collectivist society, they may prefer that their whole family is involved in counseling. Those resources are available, but there's a waiting list. And so perhaps making some preliminary calls and getting some good resources together so that you know some good family counselors, or you know some good agencies, and you know what the waiting list is. And you want to make sure that there are family counselors who are culturally competent. If you have a good resource list of people like that, then you can make some very good referrals for people to help them. Crisis support is often available through hospitals, but it's also available through, more localized crisis units. For example, if children go into crisis, there are a lot of children's mental health centers who can be helpful in that regard. Children's mental health centers can also do family counseling. And so they're an overlooked resource sometimes. If children are having trouble at school, you can often make referrals to children's mental health centers, and those mental health centers will provide counseling to the entire family. Strengths-based instrumental support. What I mean by that is helping people to actually identify what their strengths are and how those strengths could actually be used in moving forward in their careers or in their lives. Just generally, what personal qualities do they have? If someone is very outgoing and they seem to be able to connect to people very easily, then one of the things you might want to have them do is suggest that maybe they should take a marketing or a sales course because they have those kinds of skills. They know how to connect with people. Discussions of different options and appropriate coping strategies. If somebody's not coping in an appropriate way, congratulate them on making the attempt, because even though their coping strategy may not be the best, they're making an attempt to cope. And so saying, look, you know what, I can see you're doing this, and that's a good attempt to cope. But you know what, there may be some better ways of coping, so why don't we talk about what your goal is, and let's see if we can come up with some different options for you, just to broaden your options on how you might want to cope with particular things. Helping people reframe their situation. Somebody who has a massive sense of entitlement, for example, and who makes a lot of demands. Quite okay to acknowledge that and to say, you know what? It's not unreasonable that you would want these things for yourself. So let's look at how you can get it. Basically you're helping the person reframe. Instead of complaining, let's reframe it and let's see how you can actually get to where you want to go. Because it's not unreasonable that you should want that. Cognitive restructuring. Sometimes the way people think about things is holding them back. And so helping people to actually look at things in a completely different way and completely reframe them, that can sometimes help move them out of the situation that they're actually in. By the way, reframing and cognitive restructuring is part of cognitive behavioral counseling. So where that's available, and it is available through a lot of mental health agencies, consider making a referral to help somebody get out of a very negative frame of mind, or somebody who's depressed and anxious, helping them get out of that. Cognitive behavioral can certainly help with that. Okay, I just want to quickly talk about the challenges that LGBTQ women face. And essentially, their challenges are not all that different from a lot of other women, except that they're in double jeopardy. So if they're, let's say, a visible minority woman, and they are also LGBTQ, plus they have difficulty with English, we start to see this is a person who's in triple jeopardy. Their frustration and their feelings of marginalization are going to be much greater than the general population. So we have to be aware that these people are feeling some things that other people don't go through. And so we want to start checking for some things, especially if somebody may be suicidal or they're very emotionally volatile. You want to start checking, are they considering hurting themselves? They may need some mental health resources. In other cases, it may just be a matter of helping people, again, cope with the discrimination that they're dealing with. And in this case, again, discrimination will often be the result of somebody just not understanding what somebody is coping with. They know nothing about it. And so they form discriminatory attitudes because of that. So helping a person to deal with those discriminatory attitudes and getting hooked up with people who do understand will be very important, and I'll talk about that a little more in a minute. Okay, over 50% of people who are trans live on less than $15,000 a year. Now, why might that be? Because they face discrimination in employment. They're seen as sufficiently different that people feel they won't fit into the workplace. And so quite often, they can't get into educational institutions. They can't get into workplaces because they're seen as being so different that they'll never fit in. And so they face serious discrimination in employment and quite often in education as well. That's improving. Educational institutions are starting to improve in that regard, and they're much more friendly to people who are LGBT, but there's still some ways to go on that. So oftentimes, these are people who need additional support just to be able to get through their activities of daily living and to try to pursue their goals. And I'll talk a little bit more about that, about how we could help set that up. So they are going to face stigma and discrimination in a variety of different areas, but especially housing, employment, provision of services. If they go to regular counseling services, somebody who's not familiar with the kinds of struggles that LGBT people go through, the counseling may not work for them. They have much higher levels of physical and sexual assault, okay, plus verbal harassment. They'll be harassed on the street. People will make fun of them. They'll be subject to bullying. You know, and you can imagine what that would be like, having to go out and be afraid to go out because somebody's going to pick on you just about every time you go out. Whether they go to a store or a shop, they may face discrimination there. So their whole lives are basically a challenge in the sense that they're not accepted. And having to go through your life feeling not accepted is really a terrible way to have to go through your life. So as a result, they will have higher levels of depression. They'll often have anxiety. They may engage in obsessive-compulsive behavior. They may be phobic about some things. All of these are the results oftentimes of fear, suppressed anger at the way that they're being treated, you know, all of those kinds of things. So one of the things that we do know is because of the way they've always been treated, people who are LGBTQ will often be at much higher risk for post-traumatic stress disorder. So you want to look out for that if you're working with people who are LGBTQ. You want to just check for PTSD symptoms as well. The other problem is internalized discrimination. If you've been treated badly most of your life, you're going to end up maybe feeling pretty badly about yourself. You will have internalized some of those things about, I'm not all right, I'm a bad person, you know, I'm odd or I'm strange or whatever. You may have internalized some of those kinds of feelings. And so oftentimes people who are LGBTQ need to be with other people who understand that and who can help them through. Okay, so what does help? More supportive and understanding society obviously would help. And that's where public education is so critical. As much public education as we can possibly do, we should be doing. We should be letting employers know what the situation is. We should be letting educational institutions know the kinds of challenges immigrant and refugee women are facing, especially those in special populations, what kinds of experiences they have, so that people can be much more sensitive. And if they're more sensitive, then obviously that's going to make it easier for people who are in these situations. Group responses, bringing people together who are LGBTQ especially, organizing social evenings. Something as simple as a potluck supper. Everybody brings a dish, then they get together, can watch a movie together, can talk together over dinner. Any kind of group activity where people feel accepted is going to be helpful. Family counseling if somebody is coming out where a family doesn't understand what's going on. Having the person come out in a counselor's office is going to be a lot easier than having them come out in the family living room with everybody not understanding what's going on. Seminars that are geared to for service providers. And a lot of organizations that many of you work for could be running those seminars. You could be a resource to them where you actually run the seminar and you tell them you give them examples of the kinds of things that your clients are dealing with so that they can start to understand and tailor their own services. The best kind of support is always person-to-person support. So if there are people in the LGBTQ community who have gone through similar kinds of experiences and have found adaptive ways of dealing with them, linking them to other people who are struggling is a good idea. Same thing around legal resources and human rights. Sometimes people will want to push that and say, you know what, it's unfair that I'm being discriminated against and I want it to stop. And so that can be stopped by using legal resources. And again, legal clinics may have to be educated about that to some extent. Some of them will already be good at helping people in that situation. Okay, economic immigrants. Women who have come over for economic reasons may not consider some of the things that would be really helpful for them, like if there's a business improvement association, maybe they should join. It's a great way to make contacts with other people who are also in business. So joining a business improvement association, and not just one that's in your local area. You may want to join some that are just out of your area and make some good contacts there. Service clubs, the Kiwanis, the Rotary Club, you know, the different women's organizations that are connected to those clubs. All of those can be tremendously helpful in helping people to make contacts and become more active in their communities. So the more active people are in joining these kinds of groups, these kinds of associations, the more likely they're going to meet people who are going to be able to help them advance in their careers, give them good advice, tell them how they can access certain things. Creating your own business seminars can be enormously helpful to people. And you know what? There are a lot of successful local business people who might be able to be recruited to run seminars like this for free. You know, they may be flattered to be asked because they're seen as a successful local business person. And so being able to talk about how they started, how they got their business going, what loans were available, other kinds of things can be tremendously helpful to people who are just starting out. Setting up connections to educational institutions. Get to know the people in career services. Get to know the people in student services. Start, you know, making some connections to those educational institutions and ask them questions about how you can help your clients to actually access various educational opportunities. Sit down and talk to the coordinators of programs in various educational institutions that may be in high demand for your clients. For example, let's say you have a lot of clients who want to go into business. Contact the local coordinator of business at your local community college. Talk to that person and just say, okay, what should I be telling people? How can people be successful in these business programs? You know, what should we be talking about? And how can I help them to access educational opportunities? All of those things are really, really important to help smooth the way for your clients. If you have those kinds of contacts yourself, it's going to be easier for your clients. Childcare options. People set up cooperatives, their own cooperatives. Let's say somebody's working part-time, so they work Thursday, Friday, and Saturday. Maybe they could look after someone else's children Mondays and Tuesdays. So person-to-person cooperatives where somebody looks after 4 or 5 kids for other people, and then their children go and join them in somebody else's home for another 2 or 3 days a week while their parent is working. Consider setting up a daycare business where you can actually provide private home daycare. That's a way of increasing income, but also looking after people's kids so that they can work. Establishing moms and tots groups, especially for women who are isolated, who aren't getting out, and who maybe occasionally need to speak to an adult instead of just speaking to kids. Moms and tots groups are great for that. Obtaining daycare subsidies. How do you do that? You want to sort of get in touch with the people who provide the daycare subsidies and learn as much as you can about how you get a daycare subsidy. And finally, sometimes arranging private daycare. Sometimes just putting up a note in the local supermarket saying, I'm looking for a private daycare provider, yields a number of people who might be interested, that they can be interviewed, asked for references, and they may be able to set up daycare that way. Okay, isolated homemakers, how do we help them? You literally have to go door to door because you won't find them any other way. You put flyers in different languages in particular areas where you believe that there are a lot of women who are isolated and at home. Advertise a daytime coffee club for newcomer women so that they can come out and just meet other people. Once you establish those kinds of networks and friendships start to form, they're no longer isolated, and that's what you're trying to overcome. School outreach to moms groups. So if their children are going to school, you might be able to reach them through the school. So maybe their kids could take information home. That's another way to get to people who may be isolated. Using buddy systems, once somebody comes out to a coffee club, then you can start to link them to other women who maybe have been through similar situations and who can buddy up with them and help them to overcome whatever it is that they have to overcome. Putting information cards in people's mailboxes in different languages, telling them what their legal rights are, is often very helpful, and giving them a number that they can call if they have questions about their legal rights. All of those things can help people who are isolated. Domestic violence survivors. There are a lot of resources available, and some of them are excellent, some of them aren't as good. It's a matter of having to find which resources seem to work best for your clients. So you want to contact legal resources, and you have to educate them sometimes about what the specific concerns and needs are of your client group so that they can start to tailor their legal resources. And again, I'm going to mention CLEO here, Community Legal Education Ontario. If you Google CLEO, you'll see the different legal documents and things that they have available for people. If your clients have particular needs, legal needs, and they don't speak English, CLEO may be able to even produce these documents in their language so that they can understand what their legal rights are, reading their own language. Discussion with police, sexual assault units about the needs of immigrant and refugee women. The domestic violence units. I would make contact with the police ahead of time before you have a client who is in that situation, and just talk with them and, have some back and forth chat about what the needs are, what the police need to be able to help people, and so that you can work together that way to try to make life easier for people who are in domestic violence situations. Same thing with domestic violence resources. Some will have better cultural competence and others won't. It's a matter of helping them to build that. Financial and banking institutions oftentimes are not culturally competent. They can be. Some of them are very good, but some of them aren't. So maybe they need interpretation services themselves. Might be useful to suggest that they set some of those things up, or have people on their staff who can communicate with people in different languages, tell them what their options are. It's important to report domestic violence to the police, and I know we sometimes worry, will that ruin our relationship with somebody? The fact is that if there's serious concern that somebody's going to be so badly harmed that they could end up dead, then you have to report it to the police. Because there are times when domestic violence survivors are so brainwashed, really is probably the word, by the person who's abusing them, that they don't even realize how much danger they're actually in. So there are times when we have to make a report to the police. If there's child abuse occurring, report it to the Children's Aid Society. And again, I know people don't want to do that, but consider that if we don't do that, we're basically raising the next generation of people who will either be abusers or people who will be in abusive situations. So Children's Aid intervention, Children's Mental Health Center intervention is really critical in those situations. Okay, segment 4, and this is just, will be probably done in about 15 minutes. I just want to go over what some of the resources actually are and how we can tailor the services. Asking mental health services to become more educated about trauma is critical. Some of them are. Some of them have very good trauma people on staff, but others don't. If in your area you don't have good trauma resources, consider suggesting to the executive director of a mental health agency, would your workers be interested in becoming trained in trauma-related issues concerning refugees? Link them up with the Center for Victims of Torture, for example. Link them up to traumatologists who can come in and actually train their staff. We don't have enough people who are trained. So getting mental health services to be more responsive is important. Refer to Women's Health Matters at Women's College Hospital. And I've given you the web addresses here because they will have more specialized services to help immigrant and refugee women who really have serious mental health problems or who have other kinds of health problems. Trauma services at Family Services Toronto. I'm not going to tell you you're going to get somebody in 24 hours, but beginning to talk to people there about trying to create a crisis referral system. If somebody's really in crisis, it may be possible to negotiate something for them, at least something interim. You can refer to the Psychological Trauma Clinic at Mount Sinai Hospital. They're very familiar and they have very good trauma specialists on staff there. These are folks who will be very, very familiar with some of the more significant forms of trauma that I was talking about earlier. So they can be an enormous resource. I would also invite them out to your agencies to talk to you and to talk to other staff in your organizations because they can impart a lot of good information about psychological trauma to you. Some interim things that you can do until one of their people can see a client of yours. Seminars for mainstream mental health services on cultural issues, very important. Don't be afraid to offer your expertise to other organizations. You have expertise in certain areas that they could very much use. So don't be afraid to make contact with staff of those agencies. Maybe come to their staff meeting and do a short presentation. Those kinds of things be very helpful. Creating support groups for refugee women both in the daytime and in the evening. Very important that they have person-to-person support. Study after study has shown that social support is one of the best defenses against trauma that we have. The more people are in contact with others who are helpful, who care about them, who accept them, the more likely that they will heal from trauma. So you can't underestimate the importance of social support. Referring to what Rexdale Women's Center. I know it's in the West End, so some of you are probably working in the East End, but I'm sure that there could be even a partnership established because they do very good work. For LGBT women, the Hassle-Free Clinic downtown serves the gay community, and they can be enormously helpful around health issues that LGBTQ women face. Family counseling for gays and lesbians is available through the David Kelly services of the Family Service Association. Again, it's a trek, but it's basically a subway ride. If people can get down there, those are very good resources. A lot of newcomer settlement services are very helpful, but especially at places like 519 Church, where they regularly deal with LGBTQ people who are immigrants, and so they will have some specialized resources as well. So we did pretty well. It looks like we wanted to wrap up by 3:45, and it looks like we have. If you have any other questions, please feel free to type them now, and I will answer them. Can you please send us the resources and PowerPoint presentation? Somebody's asking for, and there's not, everyone's nodding their head yes, so you will get those. Are there other questions? Someone thanked me. Thank you very much, Paola. Okay, sorry, I couldn't see. I'm just going to look and see what else. Yes, the PowerPoint presentation. Okay, yes, definitely we'll do that. Okay, anything else? Other questions? Okay, then thank you very much. You've been very patient. You've been great listeners.
Hi, everyone. And that is it for our webinars today. And I just wanted to take this opportunity and thanks everyone for joining us with working with immigrants and refugees women this afternoon. And I also wanted to thank Dr. Spindel for spending the afternoon with us. It's such a wonderful webinars, and I was one of the audience, and I really enjoyed it every time. And I hope to have her again for our future webinars that we will put on. And please, at this time, I take a few minutes to fill out our survey. That will help us a lot in the future. And enjoy the rest of the afternoon. Thank you very much. We off?